You already have a tight schedule, and now you're preparing to receive a student for a clinical rotation, but you wonder, how are you going to fit it all in? I'm going to share a few time management strategies with you, which may even allow you to find that you've gained time while having a student under your supervision. Don't be alarmed if the first week or two require more of your time than subsequent weeks. This is normal. During this period, the student is adapting to the learning environment, and you're adjusting to their learning style. The first thing you should do is to reflect on who it is you will be teaching. What is their level? What is their learning style? Their background? What are their previous experiences? You can gather some of this information ahead of time, but you may need to adjust after the first few weeks once you get to know the student. You also need to reflect on what it is you will be teaching. What are the learning objectives for this clinical rotation? What are the students' personal objectives? And also, what are the rotation expectations according to your specific site? You also want to reflect on how. What are the teaching methods that you will be using to achieve these learning objectives? Reflecting on these items will assist you in the next step, which is to create a plan. This is one of the most important pieces of gaining time in a clinical rotation. You should plan what the student's schedule will look like. How many patients will they see per day? How will they progress? If possible, you should assign clients ahead of time. What are the students' responsibilities? How much independence should they expect to have? What will they need to review prior to placement to be prepared? You may need to guide them, and you may need to verify their resources. Ensuring that the student is using the right tools and is well prepared will save you time in the long run. You may need to outline how things will work during this placement as well. Set aside specific time for them to practice with you or ask questions, ideally on a daily basis. You need to determine what works best for you and the student. You might also want to consider other opportunities that could be beneficial to the student's learning within your setting. For example, they may want to sit on an evaluation with another healthcare professional, or they may be able to attend a surgery in a hospital setting. And very important to communicate your plan with the student to avoid any confusion. You also need to decide on your teaching methods, and you should use a variety of teaching methods. This will allow for a better progression throughout the placement. You also should consider having a student manual for your clinical setting, specific to your site. If you don't have one, you can even consider having the student work on this and develop the manual to then present to the team as their student project for this rotation. This will be useful for the students as well as the supervisors. The next thing you should do is evaluate. Was this effective? Was this time well spent? Did it produce the desired outcomes that you wanted? If so, continue along this path. If not, you may need to adjust. For example, if you schedule 30 minutes in a day with your student, is the student actually learning what you expected? Is there a better way? Is this effective use of your time? Another excellent strategy is to promote student accountability. Sometimes we forget that the student is responsible for their own learning. They should arrive with learning objectives that you can review together. They should be monitoring if they're progressing throughout these objectives. You can also redirect some of their questions back to them. Ask them to find the answers and then get back to you. Have them use reflective journals. This can allow them to reflect on their learning, achievements, and needs. Before offering them your feedback, ask them for their thoughts and reflections first. You can ask them things such as, how did you think that went? Was it effective? Could it have been done differently? What do you think is going on here? What led you to that conclusion? Allow the student to identify their own learning needs and the next steps in their learning. When we are encouraging the student to be accountable for their own learning, we are allowing them to develop tools necessary for lifelong learning, and we're also taking some of the pressure off of our own shoulders. Another strategy that you may want to consider is supervising 2 students at the same time. It may seem like having 2 students at once would be more work, but actually many supervisors who've tried this model find that it is quite effective. The students can practice techniques on one another and share their ideas in clinical reasoning. This means that some of the questions will be answered amongst themselves rather than having to ask you. They can also teach one another, and since teaching is the highest form of understanding, this can prove to be a very effective strategy. It's also important to remember to let go. Sometimes it's hard to let go. We feel the need to be next to our patients at all times, and in some situations, this may be necessary. Of course, patient safety is always our priority, but as possible, allow your student to do certain tasks on their own. This will nourish their self-confidence and will allow them to gradually become independent therapists. As you develop your trust in their skills and reasoning, you can gradually give them more tasks to perform independently. This will also allow you to have more time to dedicate to other tasks, such as reviewing their charts. Thank you for listening to this presentation. I hope you'll be able to apply some of these strategies to your own clinical setting and that you'll find that you have extra time when taking on a student.